Hey there, future CNAs. Ready to level up your skills and confidence? This video is just the beginning. We have even more CNA practice tests and lessons waiting for you, and the best part, it's completely free. So check it out. Now let's get started.
Question 1. You arrive at the client's home for care. She shows you a burn on her arm. It is blistered and client is complaining of severe pain. You should A. Call the home health case manager. B. Drain the blisters and cover with gauze. C. Call the client's doctor. D. Call the client's daughter. The correct answer is A. Call the home health case manager. A burn that develops blisters can be serious and should be evaluated if it covers a large area of more than 3 inches, 7.6 centimeters. The client's skin may appear red, white, or splotchy, with swelling. The client will also complain of severe pain. Do not break blisters. Call a supervisor for assistance. Question 2. A resident puts on her call light to let you know that there was bright red blood in her bowel movement. What should you do? A. Notify the nurse immediately. B. Ask the resident if she ate beets recently. C. Tell the resident not to flush her next bowel movement. D. All of the above. The correct answer is D. All of the above. A sudden appearance of red or blood in a resident's stool should be assessed. Although it could possibly be from diet or a hemorrhoid, it could also be a sign of internal bleeding. Notify the nurse to assess the situation and follow up with the resident's doctor. Question 3. A resident with an obstructed airway. A. Cannot speak. B. Can speak. C. Is always unconscious. D. Can breathe. The correct answer is A. Cannot speak. Choking occurs when food or an object is stuck in the trachea, windpipe, or airway. A person who is choking cannot breathe or speak. They will automatically grasp their throat. Quick action is required. The Heimlich maneuver, abdominal thrusts, is used to dislodge the object. Do not perform the maneuver if the person is coughing forcefully and able to speak. Question 4. A patient complains of pain. The CNA should A. Tell the patient to ask for the nurse. B. Get the patient some pain medication. C. Call the patient's doctor. D. Notify the medication nurse. The correct answer is D. Notify the medication nurse. As the CNA, your patients will often tell you first about their pain. It is beyond the scope of CNA practice to give a medication, but appropriate to report it to the nurse. The nurse can talk to the patient about the pain and give medication or notify the doctor. Question 5. The first aid treatment for hemorrhage is to A. Run and get the nurse. B. Put on a tourniquet. C. Lower the arm below heart level. D. Apply direct pressure. The correct answer is D. Apply direct pressure. Hemorrhaging, heavy bleeding, should be stopped as soon as possible. Use direct pressure on the wound with a sterile bandage or clean cloth. Use your palm to press firmly. Maintain pressure by adding more layers of bandages and binding the wound with tape or cloth. Do not remove the bandages if bleeding continues. Continue to add layers and keep pressing. Always call for help as you begin first aid. Question 6. While assisting a resident with walking, the resident becomes faint and begins to fall. The nurse aide should A. Ease the resident to the floor and call for help. B. Hold the resident up and call for help. C. Hold the resident up and continue walking. D. Carry the resident back to bed and then go for help. The correct answer is A. Ease the resident to the floor and call for help. If a resident begins to fall while walking or standing, do not try to catch them or prevent the fall. Call for help. Control the fall by easing them to the floor. This prevents injury to both the resident and the nurse aide. It also allows you to protect the resident's head from hitting the floor or an object. Stay with the resident until help arrives. Question 7. Your home health client has a very cluttered home and is reluctant to throw away anything. Your main safety goal should be to blank. A. Encourage the client to enter a nursing home. B. Organize the items and keep a file of their location. C. Maintain a clear pathway through the home. D. Throw away anything you feel is not needed. The correct answer is C. Maintain a clear pathway through the home. As a home health care provider, your goal is to maintain a safe environment. Assess the area for potential hazards and act to minimize or eliminate them. You are not authorized to remove any items, so move them out of the way. The client's health, safety, and well-being are your priorities as a caregiver. Question 8. A patient asks for an extra pat of butter from an aide who is unfamiliar with her. The aide should A. Offer margarine instead, because it is a healthier option. B. Check the patient's diet and give the butter if allowed. C. Get her the butter to demonstrate excellent patient care. D. Refuse and tell her that butter is not good for anyone. The correct answer is B. Check the patient's diet and give the butter if allowed. Every patient has a diet plan that is specific for their medical condition. When working with a new or unfamiliar patient, always check the care plan or orders for the prescribed diet. If an item is not allowed, help the patient understand that there is a reason for the restriction. Ask the nurse to request that the dietitian visit the patient to explain the diet. Question 9. When a patient who has been dizzy is showering, you should A. Take care of the patient's roommate while the patient showers. B. Sit the patient in a shower chair and remain nearby. C. Start another patient's shower to save time. D. Get the patient started, then leave to respect privacy. The correct answer is B. Sit the patient in a shower chair and remain nearby. Showers and baths present a risk for falls. If there is any doubt about a patient's ability to maintain balance, use a shower chair. Sitting in a chair lets the patient be safe while enjoying the warm spray. Before having the patient sit, make sure the shower chair is clean and sturdy. The patient's feet should be able to touch the floor. Question 10. If a resident is vomiting in bed, position them immediately in the A. Lateral position, B. Sitting position, C. Supine position, D. Prone position. The correct answer is B. Sitting position. Sitting is the best way to prevent aspiration. The contents of the stomach have less of a chance to enter the lungs when a resident is in an upright position. Question 11. A patient suddenly has shortness of breath, followed by loud gasps for air. After calling for help, what should you do? A. Offer the patient a drink. B. Check the patient's vital signs. C. Raise the head of the bed. D. Start oxygen at 2 liters per minute. The correct answer is C. Raise the head of the bed. When a client is having difficulty breathing, Fowler's position can provide relief. When sitting in Fowler's position, the client is upright at 90 degrees, allowing the chest to expand as much as possible. Prone, on the abdomen, supine, on the back, and lateral, on the side, are all flat positions, which can make respiratory distress worse. Question 12. What is the CNA's responsibility after calling a code blue? A. Assume responsibility for the code blue. B. Participate as a full team member. C. Leave as soon as the code blue team arrives. D. Be available for any necessary tasks. The correct answer is D. Be available for any necessary tasks. As a CNA, you must call for help, get the patient into a flat position, and begin CPR. When the code blue team arrives, allow them to take over. Be available for any requests, such as documenting the code, getting equipment, keeping the area clear, taking blood to the lab, or making phone calls. Question 13. Mr. Francis complains of pain in the left chest area. The first thing you do is blank. A. Call 911. B. Tell the nurse. C. Notify the doctor. D. Administer nitroglycerin. The correct answer is B. Tell the nurse. As a CNA, you may be the first healthcare professional to observe or hear a patient's complaint. Always report it immediately to the nurse. Some patients may have nitroglycerin at their bedside, but you cannot administer it. Tell the nurse so they can evaluate the situation. Question 14. A nurse aide walks into a room and sees that the patient is unconscious. The first thing the aide does is to A. Hit the patient's chest. B. Press the alarm to call the code team. C. Shake the patient's shoulder while shouting his name. D. Tilt the patient's head back and give 2 quick breaths. The correct answer is C. Shake the patient's shoulder while shouting his name. If you find a patient who is unconscious or unresponsive, do not immediately begin CPR. First, shake and shout by calling their name and asking if they can hear you or to open their eyes. If they do not respond, call the code team, lower the head of the patient's bed, and begin compressions. Even if they do respond, notify the nurse immediately. Question 15. While giving a bed bath, the nurse aide hears the alarm from a nearby door suddenly go off. The nurse aide should blank. A. Pause the bath, make the resident safe, and quickly go check the door. B. Stop the bed bath and go check on the location of all assigned residents. C. Continue the bath and listen for a few minutes to see if the alarm stops. D. Continue the bath, but report the alarm to the charge nurse. The correct answer is A. Pause the bath, make the resident safe, and quickly go check the door. An unexpected door alarm could indicate that a resident has eloped and could be in danger. If possible, call for help from a team member. However, the nurse aide should not assume that someone else will follow up with the alarm. Pausing the bath and making sure their resident is safe before checking the door is appropriate.
Question 16. Safety measures to prevent accidental poisoning from medications include A. Call medication candy so patients will be more likely to take it. B. Transfer medications to other containers. C. Give medication in the dark to avoid waking the patient. D. Never leave medicine out where it can be swallowed. The correct answer is D. Never leave medicine out where it can be swallowed. Accidental poisoning from medications can be prevented, especially among children who are at the highest risk. Medications are the leading reason for poisoning in children. About 95% of medication-related poisoning among children happens when medication is available and children are unsupervised. All adults are responsible for storing and dispensing medication safely. Always use child-proof tops and keep medications in their original containers. Don't take medications in front of children who like to mimic adults. Never call medicine candy. When taking medications during the night, turn on the light to ensure the proper drug and dosage is being taken. Question 17. You must be especially careful about fire if the resident is receiving blank. A. Heat treatments. B. Intravenous fluids. C. Sleeping medications. D. Oxygen. The correct answer is D. Oxygen. Oxygen feeds fires because fire needs oxygen to continue burning. Normal air has 21% oxygen, which can be serious in healthcare facilities. Areas where residents are on supplemental oxygen have 23.5% oxygen, which increases the intensity of the flames. If possible, turn off the oxygen supply, close windows and doors when evacuating residents. Question 18. If a diabetic resident develops symptoms of increased thirst and urination, blurred vision, weakness, and a fruity-smelling breath, what should the CNA do? A. Offer the resident orange juice. B.
Report it immediately to the nurse. C. Wait for 15 minutes, then recheck the resident. D. Report the incident at the end of the shift. The correct answer is B. Report it immediately to the nurse. When a resident with diabetes exhibits signs and symptoms of high blood sugar, hyperglycemia, do not give additional sugar such as orange juice or candy. Notify the nurse immediately because the resident needs insulin. If the blood sugar is not lowered, ketoacidosis, a serious complication of diabetes, can result. The CNA should be aware of which residents have diabetes and what to look for regarding reactions. Question 19. If you see a fire, your first action should be to A. Call the operator. B. Pull the fire alarm. C. Get a fire extinguisher. D. Evacuate patients in the area. The correct answer is D. Evacuate patients in the area. The nurse aide should be familiar with all fire safety policies and protocols. When a fire alarm sounds, all staff must respond to keep patients safe. Question 20. Factors that increase a resident's risk of falling include A. Sensory problems. B. Medication use. C. Muscle weakness. D. All of the above. The correct answer is D. All of the above. As people age, their physical and medical conditions can lead to increased risks for falling. Muscle weakness, especially in the legs, is one of the most important risk factors. Medications and the side effects can cause dizziness or confusion. Sensory problems, such as numbness in the feet or foot pain, increase the risk of falls. Other risk factors include poor vision, balance problems, and slow reflexes.
Thank you for watching this video, and we hope it was helpful. Click the link right here to start your free 3-day trial to CNA Premium, which has over 1,000 practice questions that will help you pass your CNA exam on your first try.